Hello and welcome to this episode of The Heartbeats, the North East and North Cumbria Integrated Care Board's official podcast channel, giving you the latest news, innovations and health stories from across the region. Today, we're exploring the Housing Health and Care Programme, a key initiative focused on the critical role housing plays in our health. Why is housing important for health? Living in a cold or damp home can harm your well-being, and this programme helps people live independently in safe and warm environments. It brings together leaders from across the North East and North Cumbria, uniting them around a common goal. We'll discuss how the programme started, its main focus areas, and the partnerships that make it possible. And joining us here today is Jacqueline Myers, who is the Chief Strategy Officer for the North East and North Cumbria's Integrated Care Board. So hello Jacqueline, and welcome to the podcast here today. So I guess what we'd be kind of curious to know initially is how did you get into this line of work in the first place? You know, what journey have you been on to get to where you are now?
Gosh, Alistair. Well, I've worked in the health service for just over 30 years, and for most of that time in hospitals. But a couple of years ago, I started to get much more involved in work in the wider community. I was working in Hull at the time, and this really opened my eyes to the opportunity to go, I guess what we call upstream, and address some of the wider determinants of health and how potentially that was more impactful even than working to provide the best services within a hospital. So when this opportunity came to come up to the North East and North Cumbria, I'd sort of jumped on board, and here I am.
Obviously talking about going upstream and almost, I guess, fixing things before they become an issue. Housing is one of those very particular issues, and I think what we'd be kind of curious to know is, so why should we worry about housing and what's it got to do with health?
Sure. Well, lots of people listening will be familiar with the Michael Marmot very seminal report around the wider determinants of health, and I think he suggested in that report that 80% of our health and well-being is defined by wider determinants, and only 20% is affected by health services. So that's why, in a nutshell. And why housing in particular? Well, it's really interesting. When I first came up to the North East and North Cumbria and started engaging with lots of partners and people around the patch, housing just kept coming up. For example, talking to a GP colleague down in Middlesbrough, made the comment, if there's one thing I could improve for the patients coming into my surgery, it's their housing conditions. It's so important in defining how people live and how their health and well-being is. So from an early point, and I know for Sam, our Chief Executive, we recognised that housing was a key area. We wanted to do some partnership work.
Our region is very varied, both geographically and demographically. Obviously you've got sort of wide expanses of rural areas and some very heavy ex-industrialised urban centres as well. I think it'd be good to know sort of what's the overall picture of this region, and how do we bring all of these varied demographic and regional differences together in one pot, basically?
Yeah, I mean, there's no easy soundbite answer to that, Alistair, and I wouldn't want to try and encapsulate all that variety into a couple of sentences. I suppose we're alive to that difference and variation, and the way that we make sure we take account of it is in the way that we structure these big programmes of improvement and transformation work. We make sure that we engage at every level, and if we think about the Housing Health and Care Programme, that's really a partnership of teams working more locally, and we absolutely recognise that it won't be the same solutions to make sure that people have the right housing for them. So, warm and dry is important. It's important to everybody that they have a warm and dry home, and that they have a home that meets their particular needs. But quite what the improvement needs and deficits are in each community will differ. So the programme is kind of broad and deep enough to take account of that difference.
Can you tell us a bit about the Housing Health and Care Programme? Sort of what is it and what are its main goals?
Sure. So it's very much a partnership. And from the get-go, we recognise that although the the NHS, in the form of the Integrated Care Board, has got an important part to play in the intersection of housing and health and care. We're just one of the partners, and we needed to construct a programme that was very much co-led by, if you like, the key stakeholders. And so it's co-led by the Integrated Care Board, by representatives from our local authorities across the North East and North Cumbria. Also, we thought really important to get the actual housing providers directly involved, and we're lucky to have the Northern Housing Consortium on our patch who represent the vast majority of housing providers, both those in councils and those in the private sector. And then also we're lucky to also have the involvement of the Tech-Enabled Care Association, who are really influential in thinking about how we find practical solutions to support people to live in their own homes. So they're the four main partners, but we also engage very much with people with lived experience and particular challenges in relation to their housing, with people from the voluntary community and social enterprise sector as well. So it's a real partnership, recognising that everyone's got a different perspective to bring.
And then, so I know you've already mentioned warm and dry homes are, is a priority. What are some of the other priorities of the programme?
Sure, thanks, Alistair. So we've got three priorities: warm and dry, as you say, which was a really important priority for us, something that our housing providers are very focused on following the tragic death of a child in a home in Rochdale. Our other two priorities are, secondly, to think about making sure we've got more options for older people to live the lives that they want to live independently as long as possible. And our third priority is around supporting people who've got complex health and care needs, whether they're physical or as a result of a learning disability or a mental health condition that means that they need specialist housing support. So they're the three areas that we're focused on in the programme.
There are so many partners who are involved in the Housing, Health and Care programme, and you've already spoken about the different organisations involved. How did you all come to sort of an agreement on what the shared priorities are going to be for the programme?
Yeah, I guess a lot of talking and a lot of engagement, and recognising that it's important to start somewhere. So I suspect that the programme may grow over time and take on other work streams, but it took some time, but it was relatively easy to agree somewhere to start. And as you've heard from the three priorities I've described, they're quite broad. So that was deliberate as well, because it left room for us to continue to work around what the specific initiatives are that we're going to deliver under those priorities. And indeed, they could be slightly different in different parts of the patch. So I think one of the reasons we were able to agree them is that we left room for manoeuvre in terms of the very specific initiatives that we'll take, depending on what's going on, say, in Sunderland or in Carlisle, and how that might shape it.
So I've heard of something called the Housing Lynn Report. Would you be able to tell us and our listeners what is the Housing Lynn Report and what does it say?
So the Housing Lynn is the Housing Learning and Improvement Network, and it's a membership network for housing providers, local authorities to share good practice, promote innovation in the sector. So we chose this organisation to work with as a partner, and the brief that we gave them was that we've set three priorities. We really want to understand the baseline position across all of our local authorities and places, what's already happening, and what's the need. So can we start to forecast, if you think about our priority in relation to people who've got complex needs, can we start to forecast, how many people we're going to be needing to create specialist housing for, compared to how many schemes we've already got in the pipeline, and therefore what's the gap and what else do we need to plan for? So that was the first part of the brief, and they've done that for all three of our priorities. The second part really was what's the best practice out there that relates to these three priorities? What can we learn from elsewhere? Can you bring that together for us in a report so that we can share that with our partnership board and really start to think about where we might sort of draw clever and innovative solutions to some of the challenges that we've identified.
This year was the Housing, Health and Care programme's second conference. And that was looking at the highlights throughout the year. But I guess what were some of the main takeaways from that event?
Sure. Well, the first year, we very much focused on co-producing those priorities and making sure that was a democratic process. So this year, as you describe, we're able to get some case studies. There's some work that's going on at various parts of the patch, and that was great for sort of sharing and learning, because there's nothing like hearing it from the horse's mouth, as it were. We also had some really powerful testimonies from someone with lived experience and some of the challenges that she'd experienced in trying to navigate her care and support journey. So I think the vibe, if I can put it that way, at the conference this year was very much about, okay, so now let's crack on. Ideally, we would have had the Housing Limb report at the point at the conference, so we could have shared that as well, and it wasn't quite complete. But I think nonetheless, the sense was we've got our priorities, we've got a sense of where we're at. There's some great practice out there, a real appetite to get going. So I'm looking forward that hopefully by the time we get to the third conference, we'll have more impact to share with the community.
So, would you be able to elaborate on the community of practice and its direct impact or influence on the housing, health and care programme as a whole?
Sure. So this is something that we were really keen to set up from the get-go. So it was part of the programme arrangements that we agreed to when we first set out our plan for the programme. And it's a forum where people who work on the front line in the housing, health and care sector, and indeed people with lived experience, can come together and share some of the experience they have day to day, some of the challenges that they experience, and have a direct input into the shaping the way the priorities are addressed. It's also somewhere we can take ideas that have been generated on the programme side and test them to see whether they'll fly. Are there any things we haven't thought of? Are there different ways we could approach the problems? It's met 3 times now, I think, so it's just beginning to get going, but it's very lively. And I think it's going to be a huge asset to the programme to really keep us grounded and focused on making sure that the actions that we identify, maybe the investments that we think of prioritising, are hitting the spot in terms of the people who will be on the receiving end, in certain terms of, it's their houses, their lives, or indeed the practitioners who will have to deliver them.
And just out of interest, if anyone is interested in joining the community practice, how would they go about doing that?
So they just need to contact us either via the ICB website, email myself. There's a colleague, Sean Cocking, who very much supports the community of practice and is a real advocate for it. So just contact one of us and we can put you in touch. Very much an open forum. And it has a mixture of in-person and online events, so that even if you can't travel to get to the event, you can connect online, or all the way around if you're not digitally connected but you want to attend in person, you get the opportunity to.
If you were to say that the housing, health and care programme has been a big success, what does that look like? Where would you like to see the work that is being worked on now? Where will that take us in 2, 3, 5, 10 years down the line? What does success look like?
Yeah, great question. I think we'd have lots of individual stories where people would be telling us about how their lives have been improved as a result of improvement in their housing conditions, or perhaps accessing an adaptation to their home, or even a new home that absolutely met their needs. I think we've got really clear data on some of the housing hazards. Damp and cold homes would be able to show in those measures at scale across the North East and North Cumbria patch that things were improving. I think some of the other sort of measures of success we're thinking about is, can we measure the degree to which our population is able to spend more days in their own home and fewer days being admitted to hospital, for example. It'd be great to show that for our older population and the population with complex needs, that those individuals have been able to spend more time living the lives that they want to live and less time having to spend time in hospital or a care setting.
Maybe in terms of the direct next steps now, so maybe we're talking a couple of months, 6 months. What sort of are the key things that the housing, health and care programme will be working on?
Sure. So we have now got that baseline assessment that we talked about earlier. So we're now thinking about the response to that. So there's lots of actions in there, lots of learning. I would hope that by the time we get to the next 6 months, we'll have a really clear set of plans and working with all of the partners, the housing providers, the local authorities, we'll start to have a sort of 1 to 5 year plan about how we've going to respond to, if you like, the gap in provision that report will clearly articulate. I would also hope that there's some relatively quick wins that we can deliver. And one thing we're looking at is whether we can apply the idea of every contact counts to help identify and address housing challenges for individuals. So, for example, healthcare practitioners who are going into people's homes to deliver healthcare support can be thinking, are there housing challenges for this individual? And if there are, is there a route that I can refer those to be addressed? And we're thinking about how we can use the social prescribing services that we already commission as an ICB to be the conduit to feed those housing challenges through to the local authorities to be addressed. Similarly, we're thinking about how we can work with our housing providers and help them think about how they can connect through to health services if people have got health challenges, but they're on the spot as housing providers. So that two-way street. So I think there are lots of ideas, and this year's got to be about really starting to hit the road and deliver. So I'm excited to see, as I said earlier, that some of that stuff will start to take effect and make a difference. Just to say, I'm pleased to be talking about this work. I'm just one of many people who's involved, but there's an opportunity for, I think, everybody to get involved in some way. So just would encourage people to think about in their daily role how might they contribute to this challenge, if you like, to address housing conditions as part of our Better Health and Wellbeing for All strategy, because there's a real opportunity to make a difference.
Thank you for listening to this episode of The Heartbeats. You can stay up to date with all of our content by following the North East and North Cumbria Integrated Care Board's YouTube channel or Spotify channel. Stay tuned for the next episode.